Hi everyone, I'm Harrison Young. Today I'm going to talk about our study regarding the travel distance and cancer care among rural cancer patients in the U.S. Mexico border region. First one, let's talk about our research background. In recent years, addressing and eliminating healthcare disparities in minority population is a growing focus of research in public health. In addition, geographic barriers to cancer diagnosis and treatment are largely exacerbated by travel distance and neighborhood socioeconomic status. However, there are few related studies for rural settings to explore this issue. Therefore, we aim to extend the effects of travel distance and neighborhood socioeconomic status on cancer diagnosis and cancer treatment, respectively, among the rural cancer patients living in Imperial County. For the next part, let's move on to our methodology. In our study, we used intake data from Cancer Research Center of the Desert, which is a non-profit cancer organization. Our data will collect from 2006 to 2019, and then will 2086 patients' intake information we use for our analysis. We use Tableau and ArcGIS Pro in our study for further analysis. For the next part, let's move on to the patient's social demographic information. About the distribution of patients' age, there were around 54% of them were between 41 to 64 years old, and around 31% of them were 65 or older. In addition, only about 4% of them were 19 years old or below. And with respect to the gender, more than 60% of them were female, and on the other hand, male accounts for around 40%. Regarding the marital status, the majority of patients were married or lived with their partner, followed by the never married group. In addition, about the distribution of ethnicity, over 85% of them were Hispanic, and the non-Hispanic white group account for around 12%. In the next part, let's move on to the cancer-related information of patients. With regard to the cancer diagnosis, the breast cancer accounts for about 30%, followed by the prostate cancer and the colorectal cancer. In terms of cancer stage at diagnosis, over 50% of patients were diagnosed at stage 3 or stage 4. Only about 2% of them were diagnosed at stage 0. In the next part, let's talk about the cancer stage categorized by different age groups. In this figure, we could find that over 40% of patients who are 65 and older were diagnosed at stage 4. In addition, over 70% of young population group were diagnosed at stage 3 or stage 4. In the next part, we also compare the cancer stage categorized by Hispanic and non-Hispanic white groups that account for majority of patients in Imperial County. We found that, according to the figure, the percentage diagnosed at stage 3 or stage 4 were greater for non-Hispanic whites than for Hispanic group. And in the next part, let's move on to the stage distribution of breast cancer by Hispanic and non-Hispanic white groups. we found that regarding female breast cancer, the non-Hispanic white group is more likely to be diagnosed as stage 3 or stage 4 than the Hispanic group. And in the next slide, let's talk about the stage distribution for prostate cancer by Hispanic and non-Hispanic white groups. We could see that the Hispanic group is more likely to be diagnosed as stage 4 than the non-Hispanic white group. In the next part, let's move on to the geocoding procedures for hospitals and residents or patients. In the first step, we eliminate the invalid data from original dataset that did not disclose address information or provide error information. Then there will 1,509 data will keep for further analysis. In the second step, we obtain the coordinate of hospitals and residents or patients by using Google Map or ArcGIS Pro. And in the third step, we mark the locations of hospital and the residents or patients on the map via ArcGIS Pro for further analysis. There were around 85% of the patients in our dataset with only one medical facility. And at this time, we only focus on this data. The figures shown below are the example for calculating the drag and the network distance. We use the network analysis closed facility function in ArcGIS Pro to calculate the distance. In the next section, let's move on to the results of our distance analysis. So for this figure, it's about the drag and stretch network distance by different ethnicities. We could see that the non-Hispanic white groups has further average traveling distance than other ethnicities. And for the next figure, it's about the drag and stretch network distance by different age groups. We could see that the young age groups who are 19 years old or below has further average traveling distance than other groups. And for the next figure, it's about the drag and stretch network distance by different marital status. We found that the never married group has further average traveling distance than other groups. Okay, that's all I have to say. Thank you for your attention.